Hi guys, welcome to the second episode of Oral Health 101. In today's episode, we are going to talk about bad breath. Have you ever been on a date and your date tells you that he or she is going to the washroom and will be back, but never comes back? That could be a result of bad breath. In today's segment, I'm going to give you 5 tips on how to combat bad breath. What is bad breath? Bad breath, also known as halitosis, is a noticeably unpleasant odor from the mouth. Whether it's coming from the mouth or it's coming from outside the mouth, we still refer to it as bad breath. Bad breath affects 1 out of 4 people worldwide at any point in time. It may affect you in terms of trying to nail a business deal. It may even make you lose friends or even lose close family members. Bad breath affects us in so many ways, so we need to find means and ways to tackle it. Bad breath can be put in so many groups. We've got the physiological and we've got the pathological bad breath. Pathologic bad breath is as a result of an apparent disease in the mouth. It's further broken down into intraoral and extraoral. Intraoral meaning that the cause is within the mouth, extraoral meaning that the cause is outside the mouth. When it comes to intraoral, certain causes include tongue coatings. There are so many of you who brush your teeth and not brush your tongue. The tongue harbors at least 90% of bacteria in your mouth, and these germs on your tongue tend to produce certain gaseous substances that cause bad breath. The other intraoral cause is poor oral hygiene. There are some people who wouldn't even brush their teeth in the morning. They may just use a mouthwash and just head out to work or head out to their offices, but it's best you take your time and brush your teeth twice daily. You don't need to use a mouthwash in place of the brushing. The mouthwash is more or less an adjunct to brushing. It's not the main thing you focus on. Another cause of intraoral bad breath is poor fitting dentures. Some people don't take out their dentures at night when they're going to sleep, and that's really wrong. You should take out your dentures every time you're going to sleep and clean them and place it in a cup of water. Wake up the following day, you brush your teeth, then you put on your dentures. You should never have the dentures in your mouth the whole week or the whole year. You need to take out your dentures every evening before you sleep. The extraoral causes, on the other hand, includes the inflammation of your tonsils. The tonsils are these structures located at the back of your throat. If these structures get inflamed, they tend to bring about bad breath. Other examples include nasal obstruction, pneumonia, kidney disease, liver failure, diabetes, and the use of certain long-term medications such as amphetamine and disulfiram. Now that I've given you the causes of bad breath, now I'm going to give you 5 tips to combat bad breath. The first tip is to brush your teeth at least twice daily with a soft bristle toothbrush and a fluoride-containing toothpaste. The second tip will be to floss your teeth at least once daily and brush your tongue. If you brush your teeth and you don't floss, what happens is that you miss about 35% of the surface of your teeth. Those areas are not cleaned if you don't floss, so you need to floss, and you also need to brush your tongue so that you avoid tongue coatings which can cause bad breath. The third tip is to clean your dentures and your retainers. You don't have to wear them all the time. You need to take them out and clean them before you sleep. The fourth tip is to avoid dry mouth. You should avoid dry mouth by any means necessary. You can do this by chewing sugarless gum. That's gum that contains xylitol. That helps your salivary glands to produce adequate saliva in your mouth to moisturize your mouth. And you can also be sipping on a bottle or a cup of water regularly during the day. The fifth tip is to visit the dentist at least once every 6 months. When was the last time you visited your dentist? We've come to the end of the second episode of Oral Health 101. I hope you enjoyed it. Don't forget to hit the subscribe button so you don't miss any of our oral health care tips, and hit the like and share button. See ya!